Hi, I'm Pugazhendhi Vijayaraman from Geisinger Heart Institute. I'm professor of medicine at Geisinger Commonwealth School of Medicine. The study was primarily aimed to assess the arrhythmia risk in patients who undergo cardiac resynchronization therapy with two different forms of pacing. One was the traditional biventricular pacing. The other was a newer physiologic pacing called left bundle branch area pacing. We were looking at the incidence of ventricular tachycardia or ventricular fibrillation and also new onset atrial fibrillation in this population. This was a non-randomized, retrospective, observational, large cohort study. It happened at 15 international centers across the globe. We had about 1,778 patients, and we performed one-to-one propensity-matched scoring and created a group of patients of 707 patients in each group for biventricular pacing and left bundle branch area pacing. So all the potential confounders were equalized and then looked at the clinical outcomes in terms of arrhythmia risk in this group of patients. So we're happy to find that physiologic pacing with left bundle branch area pacing compared to biventricular pacing in this population reduced the risk and the time to occurrence of ventricular tachycardia or ventricular fibrillation. The overall incidence was about 9% in the biventricular pacing group compared to around 4.5% in the left bundle branch area pacing, with greater than 50% risk reduction. And similarly, the incidence of new onset atrial fibrillation was even more significantly reduced, about 65% reduction in patients who undergo biventricular left bundle branch area pacing compared to those who undergo biventricular pacing. Yeah, it looks like when you do physiologic pacing, we get greater electrical resynchronization, greater mechanical resynchronization, greater reverse remodeling of the heart, thereby reducing the risk of arrhythmias, both in terms of ventricular arrhythmias and atrial arrhythmias. So it looks like compared to biventricular pacing, left bundle branch area pacing may be a better form of pacing to resynchronize hearts, and this needs to be confirmed in future randomized clinical trials. So we do have an ongoing randomized clinical trial called Left versus Left. It is a 2,136 patient study. All of the centers that's participated in this study is also going to be a big part of that study. It's going to be a 5 to 7 year follow-up study looking at overall outcomes of mortality, heart failure hospitalization, and all the other parameters that we're talking about, arrhythmia risk, atrial fibrillation, and hopefully this will give us an answer to change the paradigm of pacing in the future.